Like, would I use this? Would this help me? Separate from that, they will have to evaluate, is it worth it? What do I
Yeah.
get versus what do I have to give up?
Well, hey, Craig, welcome to the show. How are you?
I'm great. Thanks for having me back.
Awesome. I'm excited about getting you on the show to really talk about healthcare value, it's particularly when we talk about technology. So before we do that, though, give us a little bit background about yourself. I know you've been on this before. You've been talking about value and all that. Before getting into the healthcare tech, tell us a little bit about yourself, your background, and kind of what brought you into doing now what you're doing with your new book in healthcare technology and the value therein.
Sure. So I'm actually trained as a researcher. I have degrees in statistics and health economics, and I spent many years at a research foundation where we, wrote papers, went to conferences, things like that. So when I struck out on my own, I sort of gravitated towards the value component of healthcare because it was becoming more of a focus, and at the same time there was less specificity and fewer resources on, well, what actually is value and how do you measure it and how do you compare it, and a lot of, depending on who you are, you mean different things. So I have sort of narrowed in on that niche as a way to try and help healthcare companies, including med tech startups, think about value and quantify value and compare value and communicate it. So that's sort of where I am today.
Yeah, awesome. Yeah, and I know one of the previous episodes we did with you, we talked a little bit about like obviously depending on where you are, the four stakeholders of healthcare, they value it might be the same product or the same service, but they're valuing different pieces of it differently just by virtue of where they are in the healthcare ecosystem, right? So I'm sure when you're dealing with some of these med tech companies and this idea of like how do we come up with maybe even like a value proposition, like understanding that is super important, isn't it?
Yeah, I tell them really there's two things, and one is exactly what you said. There are multiple components that affect value, whether that's the perspective, a payer versus a provider or versus a patient, where it is in the care pathway, who's involved, the level of sort of disruption or uncertainty. There's a number of things that affect value. So that's one thing, is it's multifaceted. The other thing is really that value is subjective. And so even though you can quantify some of it and some components of it, there's a lot that you can't. And even what you can quantify, whether that is quote unquote enough,
Yeah.
is often a subjective consideration and can change from healthcare system to healthcare system. My clients, one of the things they say that frustrates them is they say, it seems like every organization we approach, they evaluate value differently and what matters to them differs. And it's, yeah, that's true because it is subjective and it's a function of multiple components.
Yeah. And like from a standpoint of like maybe trying to approach some of these organizations about the value you're going to create or maybe potentially creating with the healthcare technology device, software solution, whatever. Um, how much of that is driven by maybe the executive in the procurement seat, or how much of it is like organizational, strategic? Like, where does that break down? Have you noticed? Like, if like Kaiser or something is looking at acquiring a software of some kind, like they're obviously looking at it through maybe a strategic lens, or is it more like is the human factor still a piece of that in the buy decision?
The human factor is certainly a piece of that. Obviously, there are people with different levels of influence within an
Yeah.
organization. There are different priorities. There's different requirements, timing, budgets. But ultimately, what I tell my clients is if you're sitting across from a clinician or a health system and they're considering your device, there are components of the clinical effectiveness and the technical functionality that are going to speak to the clinician or the health system in terms of, do I want this? Like, would I use this? Would this help me? Separate from that, they will have to evaluate, is it worth it? What do I
Yeah.
get versus what do I have to give up? And so really that second piece is the value piece. It's related to the technical and clinical piece. But it differs by organization. And yes, sometimes there are other people in the organization who have to be convinced And then it's a matter of, okay, can you find a champion within that organization and let them be your messenger? What do we need to equip him or her with so that they can sort of spread the message about your solution and what it'll do for them? So it really is an organization by organization
Yeah.
um, kind of approach.
It is almost like a change management thing too. You're you're changing
It
processes and
is.
implementations and
For
workflows.
sure. And I've started to refer to it as kind of a new science of value demonstration because it's not just HEOR, health economics and outcomes research. It's not just market access or pricing. There's implementation science involved in this. There's behavioral psychology. There's network science, complexity science. There's all these things about, well, how do people make decisions? How do you allow for change and make it sustainable, knowing that they interact with each other and there's all these other things going on. So it's a multi-dimensional sort of approach that sort of pulls from a number of disciplines, quite frankly.
Yeah. Well, and you mentioned earlier, like there's some of this stuff is tangible. You can get to dollars and cents, whether or not that's 100% accurate or whether they vary from system to system might change. But you mentioned also like a big part of this is like qualitative almost in nature, right? So when you're advising a client or a client organization, they have a software or a solution and it can provide clinical outcomes. So they got clinicians on board. They want to use it. They want to trial it. They want to implement it with patients. Like, what's that step for them to get into having that value discussion? Or is it wise for them to lead on some of those intangibles, or are bigger organizations or organizations in general really looking at, are you saving us money or are you helping us make more money? And then we go from there.
It's a good question, and I think it depends on who they have access to, who can you reach within the organization, what type of solution is it? Is it
Yeah.
strictly a clinical at the point of care? Is it an early diagnosis? Is it an efficiency administrative standpoint? So all of that will sort of
Yeah.
affect how they approach it. But I talk about sort of stages of value demonstration. And early on, you might just be sort of generally thinking, hey, we think this is going to save time or it's going to improve diagnosis or something like that. As you progress along that journey and better understand all the components, who does this affect? How? Is it going to change the care pathway? Who needs to be convinced? Who's going to take on risk if they do this? All this sort of stuff. Once you better understand that, then you can move on to, okay, how best should we frame this message? What can we quantify? And then how do we communicate it in a way that speaks to whatever decision maker we're going to be talking to in terms of who's ultimately going to decide, are we going to adopt and pay for or fund this solution?
Yeah. So I'm assuming a big part of this then is like getting not just clinical data, but then like some of those objective metric data. So I guess they're doing this through beta testing or like trials within organizations. Like, is there a size at which it makes a difference? Like, oh, we trialed this in a privately held, maybe community outpatient clinic that's got, a couple hundred patients versus like a big hospital. Like, I'm sure all of that kind of plays into some of this calculus as well, right?
It does, and whatever data you get, you can have the largest clinical trial ever, and you take it to a particular hospital system, and they're going to say, our patient population is different,
Is
or
different,
that
yeah.
doesn't happen here, or we have our own system for doing this. And so, really, it is an iterative process, and whatever you do internally in your organization to try and figure out what's our value message, you always need to be testing that with your target audience and listening, and not just walking in and say, we can help you serve your patients better, right? That's going to sort of cause them to say, well, I think I'm doing okay.
Yeah.
No, it's about listening. What are your current challenges? What if this were to be true? What do you think of this? And iterating. Okay, maybe our message is this versus this. Maybe we focus on this setting instead of this setting. Maybe we consider it in a different light or for a different place in the care pathway. Whatever it is, that iteration and the companies that can do that effectively are often the ones that get in the door faster and more
Yeah.
efficiently.
Because I'm assuming these are not short sales cycles. I mean, you're talking, especially in the big organizations, you're talking years sometimes, right?
Yes, I mean, or for some of the big organizations, sometimes what it is they have a product, a device, and there's another company that's come out with a new
Yeah.
a competitor that's maybe cheaper. And so it's a similar conversation that the startups have internally in terms of how do we convince people that it's worth it? Meaning you pay more for ours, but it's better. Well, why is it better? In what way? And for whom? And as quantified by what? And that's all value. And so it's the same thing. And the big organizations have those same conversations. Do we look at a subset of patients? Do we consider a certain clinical indication? Do we talk to these types of providers, large, small, rural, urban, whatever? And it is a lot about that strategy because, like I said, it's the numbers are part of it, but it's
Yeah.
also implementation science and behavioral psychology and what's the story these administrators and clinicians are already telling themselves. How does that fit into it? Um, so it's an iterative
Yeah.
process for everybody.
Well, I'm assuming too, you're trying to like on the startup side, they're trying to almost downweigh or downshift some of that implementation risk, right? Like if an organization gets a software or device or something like that, and the cost to implement it outweighs it or whatever, it fails, it doesn't whatever, it doesn't do what it's supposed to do, or it falls short or whatever in the metrics, like how much of that too is being able to turn around to one of these organizations and be like, oh, we already tried it in, or we trialed it into an organization similar to yours, or we figured this out, like kind of heading off some of those problems at the past, right?
Yes, it shows that you have the empathy to think about the person at the point of care. And it's not uncommon for um, firms to hear feedback or pushback like, we don't want to put another monitor at the bedside. The nurse already has enough. Like,
Yeah.
and that's a value question, right? That's about an additional cost, and it's in this case for attention and time and effort. But that's a cost, and if it doesn't have a corresponding benefit that the person doing that sees as worth it, it's not going to be adopted, even if it's the most clinically effective piece of machinery ever made.
Yeah. How much of like business model on the part of the healthcare organization plays a role in it? Like I'm thinking, I've talked to a few clients and they're in the healthcare tech space and they've got a whiz bang product. It's awesome, um, but the traction has fallen short simply because like how do you bill for it? Like that's a big thing, right? Like how much of it is, you know, we're positioning the value and this thing is going to be great in 10, 15, maybe 20 years when value-based care is a real thing, but right now the organization is stuck in, you know, we're billing fee for service, and if we're not drilling, we're not billing, and it needs to fit in that business model as well. Like how do you advise clients that have something that's maybe more idealistic in nature and they're trying to sell into that, but their organizations are in this, you know, they're not there yet, or they're straddling the fence.
Yeah, great question. I mean, that comes early on in their sort of considering and understanding value. It's really about, you're trying to figure out who pays, how do they pay,
Yeah.
and when do they pay. And if the ideal situation for you is through fee for service, code-based billing, that's a specific sort of subset of steps you need to go through.
Yeah.
Um, and that's the financial piece of it. And so if there are firms who are interested in that, there are specialists who do all they do is, PRMA, pricing, reimbursement, and market access type of thing. Once you've done that though and say, hey, we have a code for it, that helps because that helps with some of the value. But there's still the component of why would we do this? This adds extra steps. We gotta, legal's gonna say something to us about having extra training. There's all the other sort of non-monetary components. So it's the reimbursement piece is a critical piece because if you can't get paid for it, you're not gonna
Yeah.
make any money. But it's just one piece of the value story and the value message. And when you have that figured out, doesn't necessarily mean that hospitals and clinicians and health systems are going to adopt your solution. So it's an important part of it, but it's not the complete story.
Yeah. Yeah. And I guess some of that other thing that you mentioned was like the training, the compliance, the all of that piece of implementing some kind of new technology. How much of it is like um affecting or making that change in mindset, maybe even from the administrators and the like a top-down approach where maybe you get an administrator on board and they try to implement it, and then the boots on the ground clinicians are like, yeah, no, we're not going to do it, or vice versa, where you have boots on the ground clinicians that really want it, and then you have the decision maker ultimately saying, ah, oh, it's another expense, we're not going to do it. Like, how do you navigate those little you know intricacies within organizations?
It can be tough. I mean, and either strategy can work in certain circumstances. I think the one that works more often is if you can get clinicians excited about it,
Uh-huh.
and then they can be your messengers, and you can equip them so that they can convince the hospital administrators. And that's where you can maybe be clever about, well, let's start with a certain subpopulation or a certain setting, or as that firm, maybe you can even take on some shared risk, right? Oh, we'll guarantee that it reduces infections by this amount, or whatever, or the first number of uses is free. The ones where where the administrators and the top down really like it, but the frontline clinicians don't, is a lot harder
Yeah.
often. And I have specific stories where administrators will admit that this will save us money, a significant amount of money, and we're not going to use it, right? Our frontline nurses, our ICU nurses are already overworked. There's a nursing shortage. We're not going to ask them to do anything different, even though financially it would make sense for us. You know, those kinds of stories are not uncommon. So, but I think starting with the clinicians often makes more sense anyway. These are typically devices that often are, you know, invented by a clinician. They get it.
Yeah.
They understand the pain. And so if you can get them there, then it's about thinking through who else has to pay with time, energy, effort, money, and how does this benefit the whole ecosystem? Where are the barriers? What's the risk? What's the uncertainty? And then how do we construct that message to convince the people who have to pay for it?
Yeah. Yeah, you've mentioned risk a few times. So it sounds like from a value prop standpoint, you want to be able to show the clinical benefit, obviously. Hopefully you're able to show some financial upside, whether it be cost savings or revenue increase or whatever. Um, but risk, almost, not that it's a loaded term, but it could mean anything. Like you just mentioned, like the risk of having nurses leave is a very big risk that I'm sure a lot of hospitals don't want to take. Risk around maybe increased cost or decreased efficiency during the implementation. Like, how do you advise clients to think about risk, and how does that fit in the value? I mean, obviously it's a piece of the value equation, but how prominent of a role should it be? Like, how much of the buyer's decision is based off of, I don't want to get screwed by picking this or by choosing that, or like what is the downside? Like, how much of it is them trying to limit their exposure to risk in the purchase?
I think it plays more of a role than a lot of firms understand and realize.
Yeah.
And I don't think it's assessed or at least even talked about enough. And so I advise my clients to acknowledge it and say, these are the sources of risk. And as an economist, uncertainty and risk are basically the same thing. And
Yeah.
so I'm also talking about variability and uncertainty in terms of how clinically effective is it? Maybe,
Yeah.
like you said, maybe we have a trial of 9 patients. So how sure are we of the results that we're seeing? So that's an uncertainty that poses a risk to those who adopt it. Maybe it's not going to be as effective as they say. So how it involves in terms of value, generally, lower risk is more valuable, right? I mean, the insurance industry is built on that, right? If you higher risk, you have to pay more or you have to take on more kind of thing. So what I tell clients is do what you can to identify all the sources of risk and uncertainty. Try and strategize ways to overcome or mitigate those. And when you have quantified components of value, do what you can in terms of like a sensitivity analysis. Well, what if it's only effective this much? Well, you still save money, it's just not as much. You know, so if you
Yeah.
can present sort of a worst case scenario that's still positive, that not only makes it more credible, but it again tells that audience that you've thought of it and you're acknowledging it and you realize that you're not just sort of pushing this and that we're guaranteed it's going to be this effective, that you've done your homework and you've thought through this. And from an internal standpoint, it also allows you to see some blind spots, right? Oh, wow, this is a huge source of uncertainty. We hadn't thought about that. In our next trial, we want to make sure that we really get a precise estimate of that. So going forward, we feel good about it or whatever. And again, that's part of this iterative process. So risk is a key component of it that I sort of always am coming back to with my clients.
Yeah. Are you always trying to deload the risk from a financial standpoint for the organization, or is is the clinical piece really that big of a, not that it's obviously you don't want to like to implement something that's going to kill thousands of people, obviously, but like um are there situations, and maybe this is a strategic question for the organization itself, like maybe it's going to shift from organization to organization, but I can imagine if you have something that maybe costs less, it's a positive ROI financially, and maybe it's comparable, maybe slightly less comparable on the clinical side, maybe less effective, you might have a better chance of getting that implemented than something that's maybe super effective on the clinical side, but maybe has some like financial way upfront, it may be losses or increased investment or something like that. Like, is there a kind of split between that? Like, should people weigh more towards the financial or more towards the clinical or whatever?
Again, it really depends on the situation, and it'll vary depending on who you approach. I mean,
Yeah,
yes, you should always try and, reduce any type of risk as much as you can, financial, clinical. But again, because it's subjective, how your audience views each one of those
yeah,
is going to differ. And so I think you do your best to acknowledge it. And sometimes, especially for these startups, you're not necessarily trying to convince everybody. Sometimes what you're trying to do is find those groups who, when they see your solution, they just get it. And they go,
yeah,
yes, we've needed that. And the value assessment that you present to them really just provides the support and the sort of credible evidence that they want to be able to point to that reaffirms their gut or
that
their
says it's gonna
clinical
work.
intuition.
Yeah,
Yes. And so I think, and this, everything we're talking about translates to when they get in front of investors, VCs, whatever, as well, because the VCs, they try and put themselves in the shoes of the administrators to think through the same thing. But of course, they also look closely at the financial risk of the organization as well. So again, that's why this is iterative, and that's why it depends on the situation. And you go out and you speak to a couple of health systems. A lot of them are pushing back on the financial piece. All right, let's relook at that. How can we potentially reduce that risk or exposure for them in some way that makes sense?
yeah. Is there any kind of, well, maybe even tips or tricks to kind of help a healthcare technology company or device company or something like that identify who those, those people that are just going to get it, like, is it, I'm assuming an organization that's maybe founded by or started by a clinician might have a better intuitive sense, like, oh, because I was in this setting and this is why I built it, or this is where it stemmed from. There's high reasonable certainty that, there's other clinics in my specialty field. So maybe that's an easier one, but maybe it's like a technical founder that has an intuition that this is something really valuable or potentially really valuable for healthcare. Like, how do they go about finding, like, who is that clinician or who is that buyer that has that burning hair question or burning hair problem that I can solve with this, and it's just going to get it when I see it?
Yeah, and I think, as much as I've been talking about how this is iterative and it's different for every situation, there are certain steps that you can do. I have a couple frameworks that I suggest all my clients go through in terms of, examples are like map the care pathway,
Yeah,
identify the relevant perspectives, upstream and downstream. And just even that exercise can illustrate to you, oh, I need to not only convince the surgeon, I got to convince the rehab department, and I got,
yeah,
you know what I mean, like doing that, and then that encourages you to really look at, okay, well, why would they do this, and what's the value, and what is the problem currently, and how big is it, and if I can talk to some clinicians in that area or administrators that focus on that area, I can better understand how big of a problem is that. And often it's extremely common for some of these new firms to get feedback like, oh, this is great, but I would apply it to this situation over here.
yeah,
or or hey, this would be great if it also did X. And that's extremely valuable because then it gets at what is the burning hair problem that we actually need to solve. And if we can solve that, they're interested in the entire thing.
yeah. It's funny. I think there are a lot of times where people have something that has awesome features and it can, save time, maybe save money or whatever. Um, but it doesn't get to that burning hair question, burning hair problem. And so it doesn't get adopted simply because it's super wonderful. It's just not really solving the root of the problem. Like, there's sometimes there's these ancillary things, like you mentioned, like, oh, the downstream effects or the upstream effects. Like maybe it's going to save the doctor money, but the rehab clinicians, there's externalities there. It's funny to see that dynamic play out.
Yeah, I mean, as I've said before to others, just because there's a gap in care or a problem doesn't mean necessarily there's demand to solve it. Right?
Yes.
Sometimes
Yeah.
they're fine with the workaround, or sometimes you see it as a problem that others don't. I mean, sometimes you have a solution that can reduce length of stay, but if you talk to clinicians, they'll say length of stay is already too short given what's covered. I
Yeah.
don't want to reduce length of stay. I want to just improve how the stay goes. So things like that, really getting into the mind of who provides care and how they do it is crucial.
Yeah. So we've kind of gone through risk a little bit. We've gone through some of the uh, value piece as far as financial. You've mentioned though time and attention and workflow, and I'm sure that all plays a big piece in the value equation. So how do you think about addressing the really? I'm thinking like the time and the care pathways. Like you're talking about any new uh, procedure software solution is going to at some point change the clinical workflow, right? The process of care is going to change because we've got a new tool, even if it's, you've decreased the friction, it's single sign on, you're not having to do like you fix some of that stuff, but there's still a change in the process in delivering care because of implementing this new solution. Like, how do you think about that when it comes to the value equation and the value discussion?
I mean, it's critical, and I think the more disruptive it is, the more you have to think about it.
Yeah,
Obviously, sometimes it's a welcome change, but even a welcome change can be hard. They've always
is a
done things
change,
a
right?
certain way. It's a change, right? And again, this is where implementation science and behavioral psychology really comes into play in terms of how do you foster sustainable change? How do you encourage a certain type of interaction? The classic example is the OR timeout, which 40 years ago people would have said, you're going to do what? You're going to stop and ask everybody in the operating room, what are we doing? And but now it's standard practice. So it's an important component, and I think you have to balance it. Sometimes if change is needed and change hasn't happened in a while, the change can actually potentially be a positive, and it's really about working with them. Okay, how can we help you foster this change and encourage this change? But often it is, a situation where it is one more piece of equipment, or it is one more step, or it is, hey, I'm fine with the way I do it. We don't have problems with that. I know the statistics say, X% of patients get these types of infections, but it doesn't happen here. So you really need to, again, this is where you're going through the steps of understanding the full care pathway. Who are all the people who are touched? Who are all the people who have to sort of incur a cost, even if that cost is just a change in how they do things? Figure out where's the positive part for them. What are the benefits and the value that they get from that? And if you can frame it in such a way, yeah, you have to change it, but here's everything you get because of
Yeah.
it. And then you sort of can create within the system, if they can create a sort of a choice architecture in terms of making it more likely to remember to do this step, then this step, then this step, the easier it is to adopt and sort of spread that change across the system.
Yeah, it seems like we were just in the hospital recently for something, and they had just changed some process, and it was an epic thing. And it was like the nurse was complaining about these new pop-ups that were coming up that were keeping her from advancing to the next screen because she needed to check something or other. And so I'm sure that it's something that gets thought of maybe on the administrative part, maybe on the even on the tech side when they're implementing it, but understanding it ahead of time and then helping address it is the first part, right? And then you need to inform and train the frontline staff. So I mean that in and of itself is a cost as well. Like everybody's got to be on board with it.
Yes, and that's a cost that whether it's a clinician or administrator, they will think about.
Yeah.
Who is going to push back on this? And who am I going to have to convince? And what kind of training are we going to have to impose? And how much is it going to change how we currently do things? And then again, risk comes back into it. But hey, we already scored really high in that area in these quality measures. If that goes down, I'm in trouble. Like I don't want to change,
Yeah.
right? The status quo bias, right? There's all these sort of inherent biases that we have. And so understanding that up front will be key. And again, sometimes you can help facilitate the acceptance of that. And sometimes you're just looking for those who get it and want it, and you're just helping them with the evidence that they need to sort of support it internally.
Yeah. Cool deal. Well, we've covered a lot. If there's just one or two tidbits you'd want a listener to walk away with from the episode, specifically as it pertains to the value discussion in healthcare and med tech, what would they be?
I mean, generally, I would want listeners to understand that there are tools out there. I think if we often think of value as either sort of one-dimensional,
Yeah.
quality per dollar spent, or this amorphous thing that we can't get our hands around. And there are tools, there are frameworks. I have some, others have some. Use what you can, quantify what you can, but really it's about understanding the full pathway, understanding the relevant perspectives, thinking about risk, uncertainty, implementation, sort of holistically, and sort of, why is this worth it to whoever's going to have to incorporate it into their practice.
Awesome. Cool deal. Craig, thanks so much. Where can people find out about you? I know you've got what's the title of the book?
I just released, well, they can find me at solidresearchgroup.com. That's one word. I've written several books. Previous ones have been very academic.
Yep.
I just released an ebook that's called the MedTech Value Playbook, a guide for startups looking for funding and to gain market access. So it's really a lot less academic and more do this, then do this, then do this. It walks people through my framework of the sort of 4 stages of value demonstration. There are worksheets, there are checklists. I really think it's like something that a firm could take, work through, and get to the point where they feel really good about the value that they can express and communicate to their audiences.
Awesome. Where can they find that?
It's front page of my website. So again, you just go to solidresearchgroup.com. You'll be right there. It's currently on sale for 50% off for another couple of days. So sooner the better.
Yeah.
But yes, it'll be there for the foreseeable future.
Cool deal. Awesome. Well, Craig, thanks so much.
Thank you very much for having me.